I am going to be starting a peripheral IV. I am going to perform hand hygiene and make sure that my patient's bed is in a elevated position and that they are comfortable. Get my arm ready. I have all of my supplies within reach. I will check my fluid. I will ask the patient for 2 identifiers, make sure I have the right patient. I'm going to check my bag of saline. I will do my medication checks, check the expiration date, check the integrity of my bag and that there is nothing in it. I will label the bag with the patient's name and date, and I will initial it. And I will also label it with what it is and a start time and our stop time. Then I will get my tubing out. Okay, take off the end here. We will spike the tubing, maintaining sterility of our spike, into the bag. Make sure that our roller clamp is closed. And hang our fluid. I will label our tubing with the date and time that it was started. I will check our tubing and prime it. Find our roller clamp. First, fill this up halfway. And prime our tubing. Flush it out. Make sure there's no air bubbles. Once it has ran all the way through, we will shut it off. Check the tubing for any air bubbles. If there are, we will flick them back up into the chamber. Put my cap back on and set that there. Next, I will check. We will put tourniquet on our patient. And check, make sure we still have a pulse, which we do. If there was no pulse, I would loosen my tourniquet. So we will find a vein that we want, about 4 to 8 inches below our tourniquet, and check for good rebound, which there is. So I will loosen our tourniquet and place a linen saver pad under the patient's arm and put on my gloves. I would pick out the needle that we want. We are going with a 22, so we will get that ready. And reapply our tourniquet. Still good, still got a pulse. We're going to take our cleaner. We're going to clean the vein, scrub it, let it air dry, not fan it or blow on it. We'll get our needle, make sure the bevel is up, holding the vein taut with my non-dominant hand. We will go in at a 30 to 45 degree angle. Once I get a flash and blood return, we will advance the catheter, pull our needle out, put it in our sharps container, and release the tourniquet. We will immediately attach our tubing, open our clamp, make sure that we had good flow, which we do, so we will tighten the lure lock, get our transparent dressing. If we made a mess, we would clean around the catheter site and allow it to air dry. Once it was dry, we will take our transparent dressing and apply it like so. Pressing down around the catheter and all the sides. We will take our tape and write our initials, the date, and the gauge of our needle. Label that there. Then we will take our tubing, loop it up, and tape it down. And be sure not to. And then we would be sure to, oh, I already put my label on. So that is flowing good. I would remove my gloves, perform hand hygiene, lower my patient's bed into a comfortable position, give them the call light, and we're done.